So you might be wondering, what is it like to go to a Gottman Method couples therapist? I am a certified Gottman therapist, so I know how to answer this question. So this video is basically going to be walking you through what to expect if you were to move forward with meeting with a Gottman therapist, and also breaking down what it's like step by step, what your first session is going to be like, second, third, fourth, and once you start the therapy. So now I want to talk to you about the very beginning of therapy. Therapy doesn't start at the first session. It starts with the first communication that we have with our couples. So I, for one, the way that I do it, and we do it here at my practice, is that you schedule a 15-minute free consultation with your potential therapist so that you can figure out if it's a good fit or not. And that's an opportunity for all parties to check in and see, does this model seem like it will work, and ask any questions that you have. So session number 1, the very first session, that first session is usually 80 minutes. So in that first session, 3 things happen. A lot happens in that very first session. Number 1, your therapist is really going to be going above and beyond to help you feel comfortable, to help you normalize the fact that it's not always easy to come to couples therapy. And I tell everybody that most people are nervous when they come in the first session, even if they've been to couples therapy before, just because you're laying your life out to a total stranger. That's pretty normal. Not true for everybody. Some people aren't nervous at all. Some people love it and are really excited to sit down and get to work, and other people would much rather poke their eyes out with needles, just on your personality. Then after that, you're going to go into an opportunity for each one of you to talk about what brings you in, what things would be better if couples therapy were to work. First part of the session usually takes about 15 to 20 minutes, where each person talks about their perspective, what they're looking for. It's going to be hard to hear your partner describe what they think the problem is, because it's probably going to be different than what you expect, or how you would describe it, and that's normal. And the therapist is probably going to help guide you into noticing that, of course, you're going to look at the situation differently, but it's really important to just be listening. It's not a competition. It's an opportunity for both of you to deeper understand what the other person is looking for. Okay? So that's the first part of the first session. The second part of the first session is a relationship history. So the second part can sometimes feel a little bit like whiplash, because here you are talking about some of the problems and some of the things that you're hoping are going to change. And then you're going to be asked to say, okay, now go back and tell me about the first moment that you first met. And then what your therapist will do is they'll guide you systematically through the history of your relationship. And what's happening during that time is it's an opportunity for you to see the big picture of what you like about your relationship, what's worked about your relationship, and also it's an opportunity for the therapist to learn from you what were some of the challenges that you overcame together, what were some of the difficulties. Also, we're really listening out for unfinished business. What conversations maybe could you have benefited from having, 5 years ago that you might need some help having in couples therapy. But during this process, the therapist is mostly asking you questions. I'm going to be getting advice or guidance during this session, other than helping you move along to get certain checkpoints, answering their questions to understand, how did you decide to commit to each other? When did you first notice you fell in love? What was it like to decide that you wanted to have kids, or decide not to have kids, or, have you not even spoken about it? So we get to see the arc of your relationship. That's the center part of session 1. And then this is the part that's very unique to the Gottman Method. I'm not aware, let me know in the comments if you know, I'm not aware of any other model that does this, but in the Gottman Method, we have our couples have a conversation in front of us. So we observe them having a conversation where they're trying to solve a problem together. So basically, 1, 2, 3, turn around, talk to each other, and the therapist is just observing, because it's a scientific model. So we want to observe your baseline for how you manage conflict in this, superficially orchestrated environment, but it is very, very useful for us because we can observe some of the patterns. And also, you guys get in the habit of talking to each other. And I'm going to talk a little bit later about the dyadic aspect of couples therapy. After that first session, a couple of things are going to happen. You are going to get a long series of questionnaires from the Gottman Institute, and you will fill out those questionnaires as best as you can. And you will also meet one-to-one with your therapist as part of the assessment process. That individual session is not confidential from your partner. So we have a no secrets policy in the Gottman Method. It's a transparency agreement. In couples therapy, confidentiality is based on looking at the couple as a united front. So the identified client is actually both people instead of one person. So what that means is that we don't keep secrets from the other person so that nobody feels like we are talking about anybody behind their back. However, that individual session is one-to-one because it's mostly history. So it's basically born and raised, and the therapist will ask you a whole bunch of questions of what your childhood was like, relationship history, and also get a sense of a general intake because, of course, we are mental health professionals who need to also screen for all of those things. And if there are things that have come up that you haven't yet told your partner about, that's okay. It's not like your therapist is going to go say word for word everything you said. But if there's something that comes up that is important to be integrated into the couples therapy, your therapist will talk to you about that. Okay, and then after each of you has your individual sessions, the third session is where we go through the feedback of what we learned in terms of the assessment process. We culminate all the information from that first session, from the written questionnaires, and from the one-to-one sessions. And we take a look to see what are your strengths and what are your areas of growth so that we can come up with a treatment plan. Here is the Sound Relationship House. It's based on the research. We go through this entire house with you to talk about all of the things that we know from the research lead to happy, healthy relationships, and what we know leads to separation or dissatisfaction. And then we talk very specifically about your relationship in terms of what are the strengths that we saw in your relationship and what were the things that we thought could lead to problems if they're not addressed. Okay, you may have heard the statistic that the Gottman model is famous for being able to predict divorce with 90% accuracy. While that is true, what people often don't realize is that's without intervention. Okay, so if you get results from your assessment and it looks like there's a lot of things that need improvement, that doesn't mean that you're gonna automatically get divorced. It does mean that if you don't make changes according to those areas that need help, then things are likely to go in that direction. But the ship can be turned around with specific plans. Okay, so that is what we call the feedback session. And after the feedback session, the therapy starts. So in the feedback session, we start to transition to talk about, okay, what are the areas of growth? What are the challenges? And what are the strengths? And we're here to remind you, by the way, it's a very, very strength-based model. So we want you to keep on keeping on in terms of the good stuff, not take the good stuff for granted, and very, very gently address those problem areas in a collaborative manner. We don't tell you, hey, this is what we're going to do day 1, day 2, day 3. We talk to you about where do you want to start? What are the most important things to address? Then once you get into the actual therapy part, the intervention aspect of the couples therapy, it's less structured in the sense that the therapist isn't saying, okay, we're going to do this, from 1 to 1:15, and then we're going to switch and do this. But we do have a lot of tools to help you with the different things. As a basic summary of what you can expect in the couples therapy room is that you're going to be talking to each other instead of talking to the therapist. You're going to turn and face each other, and the therapist is going to act as more of a coach to help the two of you talk to each other in a much more productive manner. We, as Gottman therapists, believe that the way that we talk to each other is extraordinarily important. So you guys, as the couple, get to come in and decide what the topic is, and we help you make sure that the process is productive. Insofar as you're both talking, you're both listening to each other, you're both following certain guidelines about what we know is going to be much more productive in terms of a successful conversation. However, it's important to know that we do jump in a lot. We're very, very active stylistically in the sense that we jump in. If there's criticism, we're going to jump in. If there's defensiveness, we're going to give you alternative ways to talk to each other. And full disclosure, that can be really annoying to have a stranger jump in and tell you and kind of interrupt you and tell you to talk to your partner that you've been with for a million years to change how you express yourself. That's why I think it's good to kind of know what you're getting into and decide if this approach is a good one for you. So I'd love to hear in the comments any questions that you have about the approach or experiences that you've had. If you are a Gottman therapist, I'd love to hear if there's any tweaks in terms of how I describe things that maybe didn't feel accurate. I would love to have that dialogue. So thanks so much for watching.